Yes, first of all, I want to say that all of us are dealing with the same. In the in these times, it's difficult to be more difficult because they feel that they are more at risk, and it's true. So first of all, we need to know that what they are feeling is totally normal. Feeling fear, feeling anxiety, feeling depression, loneliness is totally normal in middle of an abnormal situation. Well, I think that all of our patients in oncology and palliative care feel that they are at more risk, and our duty is to help them to cope with that situation. Let them know that we are all doing our best to be with them and to cope with them, COVID-19. So part of that is to let them know that what they are feeling, it's valid and it's true. And then let them, I don't know, maybe try to recognize those emotions, because when you name the emotion that you are feeling, when you recognize what you are feeling, it's more easy to cope with that. And after that, validate, and after recognize the emotions of the patient, offer them some tools, some resources to cope better with COVID-19 outbreak. Okay, I think that all of us need to follow the instructions, the health recommendations to care about ourselves and to care others, to care about others. So it's important to follow those instructions, hand washing and all that stuff that we already know, but also to take care of our emotions and take care our emotions start from thinking about our welfare, our quality of life, and introduce some activities that we can enjoy in this moment. I think that maybe it's difficult to enjoy something when a lot is happening outside, but we can do it, and we can read, we can write, we can play, we can share with our family, make video calls, make calls, I don't know, spend time in the kitchen with our kids, with our husbands, pray, do mindfulness, spiritual practices that help us to cope. And another important thing is to focus in with what we can do, the factors that we can control, because there are a lot of things that we can't control right now, but we can control our emotions, we can control what we do every day. So make a list with things that we can do to deal with that, with this situation, and well, take advantage of our time. Yes, palliative and cancer patients need to empower themselves, and as professionals, we can help in that process. They already know how to deal with difficult times, they already know how to deal with things that are difficult for most of us, and they can transfer those skills that they are using to cope with cancer or other critical illness to cope with COVID-19. So they have the resources. And online, we also offered some tools that they can use. They can visit the page of the National Network of Psychosocial Care, Oncology, and Palliative Care in Colombia, and then they can find some resources too. Yes, I think that it's important also for professionals to know that we can ask for help, and it's important to remind that and remind to the patients that they also can ask for help always. we are part of the team, but all of us may need some help in some point of the history, and it's okay.